Good afternoon and welcome back to Cultivating Connections. I'm Amanda Brozana-Rios, the Communications Director for National Grange. Today we have one of our biggest guest speakers yet, which I'm very excited about. But more than that, we have a discussion that's super important to be having at this time. And so I want to take a minute to introduce Ann Hazlett. Ann has a title that's longer than any of ours, if you can believe that. So Ann, I'd like for you to get it because I'm going to get it interchanged here. Ann. Ann, I think you're frozen on me. Are you? Nope. There you go.
Okay, great.
It's great to see
Hello, everyone.
Your giant title, Office of the President, Director for Rural Engagement in the National Office of Drug Policy something, right?
Yes, I am a senior advisor for rural affairs, and to shorten the agency, I work for the United States Drug Czar, who is Jim Carroll.
So we are excited to have you on because we know that all of these fun things that have been happening in the world recently have kind of drawn attention away from a really big issue, especially in rural communities. We talked a little bit about this a couple of weeks ago. We had one of the gentlemen on from a partner organization that we work with, Rally. But I wanted to drill down today because I think talking directly to somebody who's advising the administration about rural policies is so important, because nothing happens if we don't have the right people giving the right advice to the people who actually get to make some of these decisions. So I'm really excited to have you, Ann. Thank you so much for coming on.
Thank you for having me.
So I know that we talked before we got on here, and you are originally from Indiana. Indiana has been, just like many other communities, but really hard hit because you have you are the middle of the country as far as the interstate trucking system. And there's, a lot of drugs and things that go into that transportation system that a lot of people don't kind of recognize. So I was just hoping that before we even get started on anything else, you could just talk about, what, when you hear about your home state, motivates you in your job.
Yeah. Thank you for that question. I am from Indiana. I grew up in the central part of the state and grew up in agriculture, had livestock and 4-H, and have spent a lot of my career to date really in farm policy. I didn't start working on the drug issue until 2017, so almost 3 years now. But what really began that journey for me was seeing the impact that it had on my home state and specifically on the rural areas. There have been some significant issues in my home state that have made national attention. There was a large HIV outbreak that was due to injection drug use. And I think that incident was really what caught the nation's attention that, wow, this isn't a big city problem anymore. This is about our small towns and our rural areas. And as I have been able to work in this issue, what I have found in my home state and many other places like it is that oftentimes the drugs are a symptom for a broader decay or concern about things that are going on in our rural areas, whether it's lack of prosperity or lack of infrastructure, so many of the issues that the Grange has been focused on for years. And so it's wonderful to be able to continue to work with partners like the Grange that I know from my farm policy days on this issue, because I know that we're all passionate about rural areas.
Yeah, I mean, we definitely are just driven to make sure that our communities are sustainable places so that, our individuals want to stay there, or individuals want to come home or move there for the first time, and that our agriculture system is so sustainable. And I know you're interested in agriculture as well, and that's actually where kind of the Grange and you started your storied history of working together, because you've known our legislative director, Bert Neller, for many years, right?
Yes, I have known Burton and have recently gotten to know Betsy Huber, a wonderful leader in agriculture. From my time on Capitol Hill, I worked in the House and the Senate for the ag committees. And then before I came to work for Director Carroll here in the White House, I also spent about a year and a half at the Department of Agriculture and worked in the rural development area. And the Grange has been so interested on, value-added opportunities for agriculture, broadband infrastructure, telemedicine, all of those issues that are underneath the rural development portfolio at USDA. But I have to say that my family grew up in Western Pennsylvania, and I have, long before knowing folks through farm policy or at USDA, I have some fond memories growing up where many a family event took place in a Grange Hall that's just outside of Pittsburgh. And so when I think about the Grange, I really think first about family and community. And I know that's why many of your members stay involved in this organization.
Your knowledge of us is going to come back, later as we're talking in this, because I'm going to call kind of your attention to what can Grangers do. So I'm so glad that we kind of set up this look at not only why you are a foremost expert to listen to about what is going on in rural communities, but also what Grange members can do, because it's hard sometimes to make that transition if somebody doesn't really understand, both the deep-seated passion and the structure for the Grange. So I'm glad that we kind of set that stage now. But I wanted to start asking you a little bit about, we all know there's a drug problem. We all know that the drug problem goes well beyond just the urban centers, as you mentioned, at this point, because our attention was on that for at least a little while. But I want to ask you a little bit about what it's like doing drug policy stuff today, because all of these crises intersecting have certainly changed what's happening in Washington, what's happening in state capitals and things. And so I just wanted to kind of get a glimpse into your day in 2020 versus a glimpse into your day in, let's say, 2018 after you were fully settled into your position.
Yeah, this has been such an interesting time to be able to serve our team here and our director as they are looking at drug policy issues, but also trying to help many rural communities with some of the immediate needs that they're facing, whether it's finding, PPE equipment during COVID or recognizing that the broadband issues that maybe they've known were present in their region are now truly an emergency because there's no other way to stay connected. A lot of my day is spent here in the White House, the Office of National Drug Control Policy. Our function is really to coordinate policy, as the name of the agency would suggest, as well as funding across all of the different federal agencies to have money for drug addiction. So a lot of my time is spent, keeping up with the different actions that the different agencies have taken, whether it's HRSA, which has a lot of money for, rural health clinics, or talking to folks at USDA to know where things are with broadband funding, a lot of that interagency discussion. But then I spend a lot of my time just taking calls and emails from rural stakeholders, communities that are looking for resources, or maybe they have an issue that they want some direction on what I've seen working in another community that they can then borrow and replicate in their own town. I had the job, whether we're talking about 2020 or 2018, is really a dream job for me because it combines two passions, one for rural communities and the other for helping people find that freedom from addiction to drugs.
I can't imagine that it's been easy to, do this job over the course of time where so much has evolved. But I'm hoping before we talk COVID, we can talk pre-COVID, because I know that you guys had some good wins. There was, right before all this started, I believe the first month or the first quarter where opioid deaths had declined in like 20 years. Is that correct?
Yes. So unfortunately, the data in this area is extremely delayed. Right now, we measure success, if you will, or challenge by the number of lives saved. So it really does come down to the number of overdose deaths that we have seen. And for those of you living in a rural community, you can understand how long it takes to get the data to flow from that county level coroner to the state and then all the way up to DC to finally be blessed by the Centers for Disease Control. So we are always running kind of a year behind in data. But yes, in early January of this year, the final CDC numbers from 2018 were released, and they showed that deaths had declined for the first time in over 30 years. It was a 4% decline, just over 4%. But in addition to the death numbers going in the right direction, that decrease, we also know with respect to opioids that prescribing has been a huge challenge, especially in our rural areas where we don't have a physical therapist or a massage therapist on every corner. And so prescribing rates can often be higher. And prescribing rates last year were declined by almost 34%. So we know that the numbers are going in the right way, but I think more importantly, we know that we have significant work still to be done. And the issue is morphing. It's not just about opioids anymore. We see rising methamphetamine use. We see a lot of polysubstance use, and all of that is quite concerning.
Can you tell us what polysubstance use is? I don't think many people are familiar with the term.
Sure. We use that term to describe somebody who might be using opioids as well, which are a depressant along with a stimulant like methamphetamine. We also use that term to describe what is not a focus of our team because of our agency's jurisdiction, but is such an issue in rural areas, and that's the use of alcohol, the misuse of alcohol. So when we're talking about polysubstance use, that might be somebody that's combining opioids along with a stimulant and alcohol.
That makes sense. There, as you know, are so many issues that Grange members care about, that rural people care about. It runs the gamut of everything. But I'm wondering, some of the biggest issues that you're dealing with regularly, where do you see the intersectionality with things like agriculture, things like citizenship, some of our other areas? Where do you find yourself kind of partnering with other agencies to talk about this issue of substance abuse?
Yeah, so I've mentioned the first issue that comes to mind, I think I've already mentioned multiple times today, and I just can't help but go there, is the broadband infrastructure. I know that's been such a priority for the Grange. I think it's been a priority for many agricultural organizations for a long time, but COVID has put a triple exclamation point on that, right? I mean, we have found out what is really the state of our bandwidth, who can work from home and be accessing care through telemedicine, all the things that we want to be able to do through that. It's a lifeline to health, but it's a lifeline to so much more. In addition to the broadband piece, I think that access to quality health care is an ongoing issue that's a priority for many ag organizations, as well as all of the partners that I work with in the drug space. And when I'm talking about access to healthcare, I don't mean just to addiction services. I also mean to the primary care that we need to keep people healthy. I was in Kansas last fall, and a rural surgeon there who was in the final years of his career said something to me that was very, very on point. He said, I get criticized for having high prescribing rates. He said, but the kind of patients that I'm working on, because of where he lived in Kansas, often haven't seen a primary care doctor in years. So by the time they get to him, he's end up taking drastic measures as a surgeon, where if this person were living in Wichita or Kansas City, they would have likely been getting the type of regular care that they need. So that access to primary care is critical, but it's about more than that too. It's some of the underlying needs we have in a community, like nutrition. I think rural hunger is a very difficult issue that we don't want to talk about. We are prideful people, but the reality is there is a lot of food shortages in rural communities. And so those nutrition issues are really important. I think another challenge that I see a lot in this work, and I know is a focus for many agricultural groups, is when we think about rural communities, there is such a challenge to being able to access the resources that are out there. Many farm leaders also are serving as a county commissioner or serving on their county council board. their hospital board. And that's where you see that there's all these dollars out there at a federal level, at a state level, but oftentimes it takes a grant writer to write a grant application to apply for that money. And so many of these communities don't have a big grant writing team on the county to help them access those dollars. So that's why I find myself spending a lot of time just doing connections to people, to an agency to know what's out there and how they go about applying. But that capacity issue that, we have cooperative extension and many universities have taken this issue on besides their extension team. But that's an ongoing challenge that, I think we need to address in these communities.
You wouldn't think about all of those interactions sometimes. And I think that's really a testament to your diverse background, and having been with rural development and things like that, to know that this is an issue with such intersectionality that it requires a very complex, solution network.
Yeah.
So the other thing that you mentioned, rural broadband, and this kind of goes to a question that I wanted to ask. I know years ago when I was growing up, I was on a task force for our county when I was a teenager, and we had a big, NIMBY issue, not in my backyard, for different things, right?
Yeah.
And that has been an issue in rural communities because we have kind of this utopian aesthetic that we don't like to destroy by having treatment centers for things, or different facilities for halfway houses or different things like that. Even though we do know that a lot of those are located in rural areas, there is quite a fight. So that means that the distance to travel when you do have an addiction is often really far, or you don't have those facilities nearby where some of these, folks live when they're dealing with addiction. Have you seen kind of a switch in some of that mentality, or have you noticed that rural communities are starting to welcome having some of these treatment centers, or are we going to start seeing that our rural folks are heavily reliant on telehealth for this, which for some folks is just not enough because they need to be removed from the environment where they're getting, having those drugs available to them?
Yeah, no, you've really hit on an issue or an intersection that I've absolutely seen really over the past year. Last December, I went home to Indiana, and I got to be spend a day with an organization that is based in a city, but they are expanding their services out into the rural parts of our state because the need is there. And they have been involved in what has been a challenging siting of a new facility into a rural community. And when I was talking to them and hearing what they were going through and getting that done, I thought to myself, wow, this takes me to some of my state agriculture days and thinking about some of the discussion that goes on with, new confined animal feeding operations coming into a community. It's almost that same recognition that there's a need here. In this case, it's a need for treatment. In that case, it's a need for economic opportunity, but there's going to be people in the community that don't want that there. I do think that the tide is beginning to change, depending on what's going on in the community. Sadly, it seems like that tide begins to change when there's a death, in a pastor's family or a prominent coach or somebody that, they think of as being a pillar of the community and the last family that you would expect to be struggling with this disease. So when I see that happen, I'm always glad that the attitudes are changing, but I'm always saddened by thinking, wow, why did it take someone dying to actually begin to shift this tone? And so I think one of the things that's so important, that a grassroots membership organizations like the Grange can be really effective at is just being willing to share stories, because when people are out talking about what's happened in their family and we're talking about it as the disease that addiction is, it really changes the conversation in the community. It's not a moral failure. It can happen to anyone, and that creates an empathy that then allows the community to move forward. I do think that having these facilities, accessible and rural is important, but as important is having some of those support services available when we want them to come back to the community. And if you don't have some of that infrastructure there as well, people can go to the big city to get the help back. There won't be those supports to help keep them well.
We did a big story in our last magazine that looked at rural health as a general thing. And it was shocking to me the number of rural counties defined, by the Census Bureau that didn't have, I'm sorry, my dog is apparently whining about this issue, that didn't have a mental health provider. And we just talked about the disease, the addiction is a mental health issue as much as it is, just drugs, right? I don't even know how better to put that. How do we fight an issue if we don't have the providers and the tools there to fight them?
Yeah. Oh, you said it well. I think that's where not all solutions will come to telehealth, because there are things that you really do need somebody there in person for. But certainly telehealth can help us, that workforce issue in rural is, of course, broader than mental health. We have challenges with having primary care providers there. So I've heard more than one treatment organization who, COVID has given us a chance to really see what could be possible through telemedicine, and because of some of the policy changes that have happened to deal with the pandemic. And I have heard more than one treatment provider say, wow, if some of these changes stay after the public health emergency, this will really change how we look at that workforce need. What are the pieces that we absolutely have to have a person there in the community in person for, and what could we use telehealth to connect to somebody who's in a larger community?
I think folks who believe that they've not been touched from addiction, and I say that because every one of us has been touched, whether we know it or not, but I think people who believe that they haven't been touched oftentimes don't know what kind of treatment options there are and what is effective in what ways and what have you. So is there anything that you can say as far as some of the things where you think there's still going to have to be kind of physically bound programming or treatment options versus some of the telehealth that you do hope, because you're seeing some positive progress, some suggestions or specific things that you wanted to mention?
Yeah. One thing that comes to mind that I've seen be incredibly successful, and I should back up and say that I don't want to suggest that I think there's a magic formula in this. I've been to 45 states since joining the administration, have spent a lot of time on the road. A huge portion of that travel has been devoted specifically to this issue. But yet you've seen one community, you've met one family, There's not a magic formula. Everyone's different, and this issue impacts them in a different way. Having said that, I do think one of the biggest needs once somebody has gotten treatment that is really powerful and important in a rural setting is having what we call peer support that can walk alongside that person as they continue in their journey in sobriety. And oftentimes that peer worker or peer support person, a lot of these folks do this volunteer. They might have a day job and this is something that they do, in their side time, but they have that lived experience where they too struggled with an addiction and got help, got treatment, and have been able to maintain that sobriety. And that really brings hope to people who are new in their own journey. And that's a piece that when I talk to people about what they've experienced during the pandemic, where everything has had to be online or through Zoom, that peer piece is something that it's relationship. And that's a piece that I think is important, likely to really keep in person.
I also think, it's very hard sometimes to get a read on things. I'm sitting here, I've got a white wall behind me. You don't know exactly what's going on, with the exception of my dog whining for a minute. You may have no idea what's around me or in my home life. And it's hard to think that someone trying to recover from addiction, who only has these interactions, even if it's daily, that the counselor or the organization providing the resource can really know, if that person is kind of staying with the program those other 23 and a half hours. And there are addictions that require kind of that more locked down setting, at least in order to initiate the process.
Right. I think another piece that I would highlight that we are hearing, being done online, but it would be interesting to see what is truly effective. And I know this has been a priority for the Grange as well, is that prevention piece. Right now, I've talked to multiple prevention coalitions at that county level that are doing, videos that they're sending to the schools, and then the schools are finding a way to put them into the programming that a child who's doing all this distance learning is already getting. But I think at some point, some of this, there is not a substitute, perfect substitute for that hands-on, relationship building, whether it's a child that you're trying to steer in the right direction or an adult that has, gotten the help they need and now needs somebody to walk alongside them to maintain that new life.
I think, that goes back to this idea of community engagement. And I'm wondering, if you can talk a little bit from your experience of what you've seen as how important it is, or why it's important when multiple organizations come together, or multiple services, or maybe an organization like ours that you wouldn't expect, come kind of to the table and say, how can we provide support? Why is that effective? How is it effective? Do you have some examples of where something like that is effective that you could give us that might give us some ideas?
Sure. So I love, when I think about community support, I quickly think about stigma, because community support really is the antidote to stigma. And the Surgeon General often says that stigma is the silent killer. And that's a pretty strong statement, but I think is so on point, because we can build, we can build a Cadillac of a treatment facility and put it smack in a town of 800 people. And if people in that community do not feel that it's okay not to be okay, that it's not okay really to go get help, they won't access, this Cadillac, if you will, that's sitting right next to them. So the stigma piece is as important as looking at the infrastructure that might be lacking in a rural area. And when a community steps up and says addiction is a disease, it's not a moral failure, it's a game changer, because people in that town who themselves are struggling can get help without judgment. And then families who have this buried secret in their family, can really step out of isolation and get the help that they need. I can think of so many different community examples where they've really taken this by the horns, so to speak. But I've got Western Pennsylvania on my mind, because I know that so many of the Grange members are in Pennsylvania. And I want to throw out a specific example, because the leadership around who's going to coalesce people to this community conversation looks different. I've seen a variety of stakeholders be the ones that step up. But in Crawford County, Pennsylvania, which is the Meadville area, they were seeing an alarming spike in overdose deaths in that county, and a real struggle for anybody to want to step up and talk about it. And there it was the local hospital system that led the way. And they created a multi-month, it might have gone over a year, campaign called Let's Talk. And that started out with people that were willing to share their stories through, videos or story in the paper. They had a number of town hall events. And what they found was just somebody willing to create a safe space to have that conversation, and somebody that had the prominence of a health system really was a game changer. And now that community has done a lot more than just working on the drugs. They've had a whole campaign about what is the future of this county, what is our county image, what are we proud of, what is the heritage here, and that goes to community pride and so many of the things that I know that resonates with rural people. Within the agriculture space, I look at the the impact that the Farmtown Strong campaign that has been led by the American Farm Bureau and National Farmers Union. At its core, I think that is really an effort of mobilizing community support, because they've created a place to say, look, our farm towns are being impacted by this. And we know that this issue for most farmers is not going to be solved by somebody from the government coming and telling them this is a disease, not a moral failure, and here's how you get help. It's going to be solved farmer to farmer. And that farmer to farmer, at some point, that's what creates community support. So I think recognizing, who can be a leader in your community to take this charge and go, and then who are you trying to reach, and what are the messages that are going to resonate with them is really important in that effort. And I have to say, that's where I get excited about rural in this space, because we often, I think, in rural America, think about what we don't have. There's only 12,000 people in my county, and it's the same 10 people that do everything, that are leading the way. And that, there's some truth to that, and I'm not minimizing that. But at the same time, when you get the right people to the table, you know who those people are, and it's easy to get them to the table because you have a smaller network that you're talking about. Just a small act can really go viral in a rural area the way they wouldn't if I were living on the north side of Indianapolis, a big city in my home state. It could take a long time to galvanize the right people around this. And so that's the hopeful side of this that I get to see working with rural counties that have said, we're going to do something about this.
I'm glad that you mentioned, having farmer to farmer or peer to peer and things like that, because I think that, that's really important. Rural America is so almost overexposed to the idea, especially of the opioid epidemic, because the type of work we do and the type of folks who live in our communities and the work that they had done in their careers is oftentimes really hard labor stuff. It's hard on the body. And if I was, struggling with addiction, could not go as a peer or a mentor to a farmer, because I have never worked a 17, 18-hour day in a field. So I will have the wrong talking points. I will have the wrong empathy points. And so I think, you mentioning some of that is really, really important.
Absolutely. I know a related issue that I don't work on every day because of the nature of our agency, but is one that so many farm stakeholders are paying a lot of attention to right now, is farm stress. And sometimes that manifests in addiction. And for other people, it manifests in somebody taking their own life and farm suicide. And, the agriculture organizations that I work with on a regular basis that are very focused on this issue have really had a lot of focus on training farmers to be able to talk to one of their peers and to sense when is something not seem quite right, and how do you have that conversation with somebody about, hey, maybe you ought to reach out and get some help.
Is that something that your branch is also looking at from the addiction perspective, not the mental health suicide perspective?
Yeah, I do. I have stayed in, in close contact with the folks that are working on the farm suicide issue, because at the end of the day, we're talking all about mental health. I think specifically with addiction, it's very easy, and I don't have the stats fresh in my mind, but when you go back and look at the statistics, it's pretty overwhelming of people who have an addiction, the percentage of people that have an underlying mental health condition. So, say we notice somebody drinks too much, we're focusing on the fact that, Jim had 5 beers last night. But oftentimes what's going on for Jim is there's an anxiety that's being medicated, or something else going on in their family. And so, yeah, I think there's a growing recognition that this is all about mental health, and it manifests differently for different people. For some folks, that will be an addiction, and for others, it will be something that they feel so overwhelmed that they could take their own life. And there are, as I mentioned, I know there's many tools that are being developed in this area. There's a Farm State of Mind campaign that agribusiness really got behind. And that's, if there's a silver lining in COVID in some of this, I think it's the fact that the country is having a conversation about mental health right now. And that is an opportunity for us to begin to talk more about some of this the way we would be talking about physical health challenges. This is not a moral failure. It's a health condition that we need to get people connected to resources for.
We had a gentleman on here, like I said, a couple weeks ago from Raleigh discussing, the opioid crisis. We talked a lot about how it kind of has faded into the night in some ways in the midst of all the other crises and different things like that. So I don't want to rehash those, but he said something at the time that I wanted to touch on again, because I think it was super important, but I think you may be able to give us additional perspective, to it as well. And that was that addiction is often not just a symptom of potential mental health issues, but also loneliness or isolation. And so ranges, as you well know, put people to work, include people in a group. We're a fraternal organization, so we feel like family and in lots of ways are. And we do good things in the community, so there's always room for busy hands. So I'm wondering if you can talk a little bit about that idea of loneliness and isolation and how completely unrelated, maybe not even talking about addiction or mental health organizations can sometimes be, positive pieces of people's lives who are trying to put the pieces back together. Yeah.
I think that theme of isolation and addiction in rural areas is very real. We have people that, depending on where you are, of course, I don't want to cast a net. Rural looks very different in my home state of where Indiana, a rural county would be 10 or 12,000 folks. You go out to some of the western states, that's a metropolis. I mean, some of those counties, I went to school in Kansas, and some of those counties have 4,000 and 5,000 people. So isolation, the reality is that many people living in rural communities are geographically isolated. On top of that, when we're talking specifically about agriculture, so when we think about a typical producer's day, whether they're in a livestock barn or they're out on a tractor, so much of that day is spent by themselves. And all of that, depending on what's going on for them, can lead to hopelessness and despair. I think in addition to that, agriculture and rural people work hard, and oftentimes you work till the job gets done. And sometimes that means, yes, there might be a Rotary meeting going on in my community at noon and I'm part of Rotary, or, it's an evening meeting. Hey, if I didn't get done what I needed to get done, I don't quit when the sun goes down. I keep going. And so before you know it, you can just be getting the job done in your work, and those other pieces that feel like there's something to get to when I have the time, the relationship piece suffers. So I love what you said about just highlighting how the Grange and the type of activities that you engage in a community can really be, it can be a healing force, because rural people are proud, and you're not always going to have somebody that's going to sit down and say, well, this is what's going on with me today, and I'm going to share my feelings. But still being in a community setting and being part of, whether, it's a potluck after church on Sunday or setting up a booth at a community festival, just being with other people and being part of that community event has that healing, healing effect that we need to see in this. I also think when we still have those types of community activity and community gatherings, we also are building protection, if you will, for the community against the drug issue only escalating. When you look at some of the places that have been really hard hit by this issue, it's no surprise that you see a breakdown in community. These aren't the places of our grandparents' generation. and that can be hard to talk about, but that's all contributing to why this issue has taken hold in some of the places that it has.
Yeah, I didn't really, I think much about this until about 3 or 4 years ago when I saw momentum back in my hometown area. We have the issue of addiction. A lot of young folks, especially, are struggling with that. And there was a man who was in recovery, young man, like probably 10 years younger than me, who came out and needed something to do, and didn't just want to sit around and talk about his addiction, but needed projects, needed an opportunity to just get out there. And he started a momentum that's called the Skook Recovers, and has basically created like the cool kid group. Like if you just got out of recovery, hey, come on, hang out with us. We're going to go, completely clean out a creek. We're going to go build a playground for kids. We're going to go have coffee shop talk hours. We're going to, all these things. And you don't have time, maybe to sit and do, get in your head. And I thought that it was so interesting, because I thought to myself, boy, Granges could be places for something like that. It's a neat idea, because you don't have to be a mental health counselor. You just have to care about other people, which Grangers are very good at doing.
Right. Well, and when I think back to my own upbringing, one of the best things that ever happened to me was to get involved in 4-H. I got involved at a very early age, and I was obsessed with, like many kids, with my livestock projects. And those livestock projects were, for me, the protective factor that kept me, going in a positive direction. And a lot of that, again, is, we can translate that to an adult or a young adult of what gives me confidence, what gives me pride in what I'm doing, and to help restore, their opinions of themselves and move forward in a positive way. I think that the potential there is enormous.
How important, Dan, is it, because we know that addiction crosses all boundaries, race, gender, ethnicity, age. So we do know that there are parents and grandparents out there who are exhibiting signs of addiction or have addictions. How important is it for especially young people to have a mentor outside of their family, who doesn't struggle with addiction? Where can we be in that part of the recovery or the prevention sphere?
Yeah, no, I think that's a great point. No family is perfect, and depending on the circumstances for that young person, if things are really not going well in their own family, especially in a rural area, to identify who are some of those assets that can be a mentor. I think an obvious place for that in a rural setting especially is the school system. Many of these school systems are absolutely overwhelmed by the impact they're seeing of this issue on children. I often say that I think kids are some of the biggest victims in this crisis, because of the impact that it's had on, choices that have been made in their family that are having on them. Beyond the school system, many communities have a drug-free prevention coalition. And so finding out if there's any current coalition activity going on, and, that might be a piece that they haven't had a chance yet to turn to, but really know is needed, and would welcome somebody joining the team and being able to find, a handful of people in the community that would be willing to mentor. Another place I think that would be a structure that something like that would be much welcomed in, depending on the county. Some counties, rural counties, actually have a drug court, and drug courts are a very effective structure that we are trying to grow. It's a priority in this office to expand that network, and we would like to see more of those in rural areas, because they've been highly effective in an urban setting. And I think that a lot of the judges are seeing these kids, depending on what the family's been through. In some cases, they may be very familiar with what's going on with the families in that community, and are looking for a positive person, to connect that young person with.
Yeah, I haven't seen any statistics out about how many of our rural counties in the country have a drug court and how many don't. But it would be interesting to see. And that's another thing where a lot of times that takes an advocate in your community to get your community behind having a drug court, because the assumption is if you have a drug court, we're just going to let all these druggies off with, doing whatever, and we're going to terrorize our communities. And really, that's not the case. So I'm hoping maybe you can talk a little bit about what drug courts are and why they're effective. So if there is a community, if there's someone here watching that's in a community that's talking about establishing one, that they may have a better perspective of why it could be a positive thing.
Sure. So drug courts are a structure that are really used to get to a certain type of person. The type of person that is ripe for a drug court is generally somebody that has had multiple intersections with the criminal justice system thus far, and is at a point that they are facing, some type of time or some type of other loss that makes them ripe to be paying attention to, hey, this might be my last chance. And most of the drug courts are structured a little differently, but most of the programs that I have been able to see at work in a rural community have been somewhere between a year to 18 months. And it's a very structured program that would often begin with getting somebody in treatment, building a relationship with that person, the judge building a direct relationship with that person. The judge is often supported by a case manager that maybe that person is only seeing the judge, every other week, but that case manager knows what's going on with that person all the time and making sure that they're keeping up with treatment. Oftentimes there's community service involved with this. If there's children that are in the mix, knowing what responsibilities they're keeping up with their kids, the stories, not every person is successful in this type of program, and there are reasons that they are challenging to build in a rural area. We don't have transportation. We often don't have recovery housing. There can be a lot of barriers, but those barriers can be overcome. And the stories that I have been able to see where somebody says, drug court saved my life, they're powerful. And from an economic standpoint, they often save the community a significant amount of money because this person has a disease that they are, having intersection after intersection with the criminal justice system, which is costing the county money. So they are a structure we would like to see more of in rural areas.
It sounds like it would be interesting because it's such a structured program, because what's happening with those folks who are in the programs. If community organizations like Granges and Lions Clubs and whomever could reach out to those programs and say, let them do their community service here. Let them join with us, because we'll be yet another layer, not just the caseworker checking in on you, but,
right.
The lady down the street who makes the best banana bread ever, coming and just checking on you. I mean, that seems like it would be such an important part of the safety net, is having the feeling that the community's behind you to get
Absolutely.
to recovery.
Absolutely. And as you're talking, what's really coming into my mind is many folks, when they are at that point in their addiction, they have very little healthy community left in their life. Very few people are cheering them on, saying, go get well. Maybe they have a child that wants that, or maybe they have a parent that wants that. But the number of healthy people, positive people that are around them can be pretty slim. And so when I think about, what could a Grange member bring to that, that example of, you don't have to live like this. This is what healthy can look like, and a life that doesn't include the things that have caused you so much pain. And yes, I think in a rural setting, those leaders that are, building that type of structure are looking for who are those support pieces that they could bring in.
Yeah, and I think, if you're talking about something so structured like that, you could have the caseworker come in, talk to the Grange about, these are the things that we recommend that you do. These are the things that we recommend you don't do. If for right now you don't put that person in charge of money, or, you don't overwhelm them with too much support, or you do overwhelm them, or who knows what the suggestions would be. But I think that could be such a interesting and positive intersection for us with people that we need to recover, because not only, as you mentioned, does it cost our communities money, but it costs our communities labor, it costs our communities mothers and fathers and daughters. There's so many pieces of it. And it also costs our communities part of our future, because there are so many communities with problems about migration. So the people who have chosen to stay, we need to stay and be productive.
Yeah. Very well said.
So I'm going to just remind our folks that we're kind of coming up on the last part of this. So if they have any questions, we did have one question from actually my colleague, Loretta Washington, who said, what programs, Anne, are there out there that you can share that the Grange can use to help with the effort? Is there anything that's already structured that we haven't just theorized here today?
Mm-hmm. Yeah, so I would flag two different resources that are helpful in that regard. One, with respect to funding, that can often, there's been so much money put forward, and a lot of what we've been talking about is about much more than funding. But I want to touch on the funding piece. There's been so much federal dollars available for this over the past couple of years that we've put together a federal funding guide. And 2 weeks from today, we are going to be launching a website that has transformed this current paper guide into a rural community toolbox website. It's super user-friendly, and it's really a clearinghouse, if you will, where somebody can come on, here's what I'm looking for dollars to help with, and then it will take them to the federal agency that has money for that need. So I will be sure to send information about that to the Grange leadership so y'all can get that out to your members. But I want to flag that I can't speak to the state dollars. And I will say that a lot of money at this issue Congress has given to the states. So in addition to following what's happening on the federal side for money, I would really encourage you, if you haven't yet, to be building the relationship with your state leaders. Many governors have a drug czar type position in their team, or they have a lead agency in the state. So would really encourage you to know who that is and to get to know some of the people that are responsible for spending that money, because that block grant dollar structure is really what allows for, if you have a project idea at a community level, oftentimes that state money might be a little easier to access. Beyond, this is about more than dollars though. It's about learning about what's worked in some communities that might be able to work in your own. And so in January, we launched, along with 18 rural stakeholder partners, a rural community action guide. And this is a guide that is available online. It includes 15 different topics relating to addiction, everything from stigma to recovery housing, access to care, broadband. And it gives essentially a little bit of information about the issue, but then it recommended action steps. And those steps were given not by me or somebody else in the government, but by our rural stakeholder partners that are really the experts on that issue. In addition to the guide, we have a supplement that is literally dozens of promising practices that we have learned about in other communities that go to each of those issues that are in the guide. And I think reading through that document, again, this is available online, and I will make sure that you have links to everything. That can be helpful just to trigger, like, hey, I can see this working where in my county, or this is something that we could take and modify a little bit. I'll give a real world example of that. In Talbot County, Maryland, which is a rural county, not too far from Washington, D.C., but you go there and you're in rural. It doesn't feel like a D.C. suburb. They really took on using the color purple and purple is often a color that's used to signify recovery. And they decided to literally paint their community purple. They changed out street lights in in the main town there. They had, the sporting towels at high school football games that were purple. And this was a partnership between the Rotary, the Community Foundation, and the Sheriff's Association. And it was called Talbot Goes Purple. That model has been replicated in many other counties now, and I know other states have been looking at it. So that's an example of something that I think, you could envision in your own community if you think it would work. Tweak it a little bit. Maybe the partners look a little bit different, but that's a proven success. And you can find those types of things in this promising practices document that goes with the guide.
I think the one important thing to note is a lot of times we've had Granges who try to go for grant money or other funding, and they get held up in the fact that a lot of the funding sources want only 501c3s, for example, to apply. In the National Grange, we have a 501c3, and some of our state Granges have them. But locally, Granges are typically what are 501c8s or 10s. Those are specific designations by the IRS. And they feel locked out. But CBDC grants, the Community Block Development Grants, those are open for most of the 501c designations, including 8s and 10s. And so I wanted to take a second to tell you out there at home in Granges, yes, they're hard because you have to figure out grant writing, but they're worth the effort because they are something that's open to you and not to everybody else to apply for. So definitely community block development grants, CBDCs, those are important. And your local even community, your local borough council or township supervisors will even know about those oftentimes and be looking for a funding partner, a person or a group to partner with.
Yeah.
I don't see any other questions. I'm going to double back just to make sure that I didn't miss anybody, Anne. But I want to tell you, first of all, I really appreciate you coming on. I appreciate 153 years worth of Grange history that has made my job so easy, because when I come to folks like you and I say, here's the things I think I'm going to ask, but I might word them differently. We might have some other questions, not balking at allowing us to ask those, because that, we're not setting you in a trap. So I really appreciate you kind of letting us flow with this conversation and really hitting some important topics. And the last part, I noticed one of our members had mentioned, and I want to just point out is, appreciate that you kept saying, stigma is a problem, that mental health is not, something to be ashamed of, that it is important that we all are well as best we can, and that we work together to make sure those folks who are dealing with abuse, addiction, or mental health issues are embraced in our communities. So thank you for bringing that perspective to the Office of the White House. I think that's super important. Last thing I was going to ask you, just because I'd like to always try and throw in a fun question if I can, and I think it's a serious question though, is you and I know living in rural communities is hard. There's challenges, but it's so worth it in so many ways. And even if we don't get to live there, as you're living in the DC area right now, you're still working for it. So if you were talking to some of the folks growing up in rural America, thinking about where their future is, and if their future lies in their rural community or not, what would you say to them?
Yeah, that's a great question. I would say that you look back on our country's history, and rural America has always been a place of opportunity. I mean, this is the place that literally feeds and fuels and clothes, that feed, fuel, and fiber of our nation. And what is exciting, and maybe we've gotten a glimpse of this with COVID, is that technology is now making it to where that opportunity is even greater, because we don't physically have to be where, the centers of where our product is going to go are, or whoever we're trying to reach. So, when you think about where you are in your own journey and whatever that passion is, whatever those gifts God has given you, go after that dream, and don't accept that you have to leave your community in order to live your dream. Find a way that, whether it's through technology or networking, that you can do and you can be who you want to be and stay in that community that you love and it is your home.
Thank you so much, Anne, for coming on here. Thanks everybody for joining us and the questions, but really thank you for that last statement, because I think that was, that's something I might have to quote for our magazine, let me just tell you. So thank you so much for being our advocate to make sure that our communities can get the resources to be as healthy as we can be in all aspects, but especially when it comes to this crisis that we have in mental health and addiction. So.
Well, thank you.
All right, guys, we will see you back here at 9 p.m. tonight for a live drawing of our grant winners from Grange Foundation for what Granges have been doing to respond to the COVID crisis in their communities. We've gotten about 100 submissions of amazing projects. We can't wait to share them with you. So we'll see you all back here this evening. Have a